My dad was a firefighter, my grandfather was a firefighter. When I started in the fire service, when the cab of the truck smelled like smoke, that was cool. When your helmet was stained full of smoke, that was a status symbol. We didn't know at the time, hey, this is causing cancer.
I grew up in a fire family. My dad was a firefighter, and so I saw firsthand what struggles he went through. And so there was no help back then. You just sucked it up, buttercup, you moved on. And there was no peer support. There was no talking about your feelings after a call.
Back in 2007, I got caught in a flashover. I was burnt over 30% of my body, spent over a month at KU Burn Center, 5 skin grafts, and then I was forced to go back to work with open wounds. And I spiraled out of control and had to fight the demons I was dealing with, but I had to do it all on my own.
A long time ago when I started, we just we'd see some horrible, terrible things, and you'd make a joke about it and push it down, make a joke about it and push it down. That's not right.
Before the critical illness pool was established, firefighters with occupational diseases had to file work comp claims. The work comp claims are constantly denied. Firefighting is a dangerous job. We all know the hazards of it. But occupational hazards and occupational injuries like cancer, mental health, PTSD, things like that, largely went unaddressed. Missouri's critical illness pool is the best in the nation. Most states only have the cancer benefit. Missouri has cancer and mental health. And by nature of just being in the fire service, if you have preventative measures and policies that you adopt, you're automatically in the critical illness pool for the mental health portion. So all firefighters, paramedics, EMTs, and dispatchers in the state of Missouri are covered under the mental health portion of the critical illness pool.
So the cancer program through the critical illness pool currently recognizes 21 different types of cancers for first responders. How that works is if you're a member of the critical illness pool and you are diagnosed with one of those cancers, it's a very easy process to file a claim. Once you file that claim with us, your benefits are expedited within a matter of weeks. As a first responder, you can use those benefits to pay co-pays, pay for treatment, or other types of support. But if you have a critical need like paying your electric bill or making your house payment, that money is yours for you to use as you most determine appropriate.
I had throat cancer in 2019. At the time, I had stage 4 cancer, which I had a 5% chance to live. And so at that time, I filed a work comp claim at the same time that I started my treatment to cover my wife and my children. And so I filed that work comp claim in June of 2019, and it was just settled in April of 2025, so it took 6 years. What we see today with the firefighter critical illness pool is that there are certain things that you worry about. How am I going to pay my bills? How am I going to mow my lawn? How am I going to, take care of my children or any of that other stuff? And what happens is when that critical illness pool's payment comes to them, and it allows them to not worry about those things.
We're long-term. We want to change the culture of the fire service. We want to see the numbers of our people that contract cancers go down. We won't know for 20 years, really, if we're successful. But in 20 years, if the number that we're seeing now is cut in half, I would say that's successful.
So originally, the cancer program was defined for firefighters, but we definitely acknowledged through the entire process that we should be able to expand into our EMS and telecommunicator partners. It's so important just due to the exposures that they have, not only on scenes, but the repeated exposure to trauma that our telecommunicators experience by answering 911 calls every day.
We're way behind the times in catching up to mental health and emergency services. Dispatchers, firemen, police officers, EMS people, way far behind. There's always been a stigma behind it, that if we addressed it, we look weak.
When I first came on, back in the day, it was like you don't talk about suicide because it causes suicide, but that's scientifically proven not true. So just getting the awareness out to the memberships just to let them know it's okay to reach out and say, I'm not okay and need some help.
We work really hard to be sure that we support members with culturally competent clinicians. And what we mean by that is clinicians who have the experience and can use the modalities that are best fit for those first responders.
It's all about the resources that it provides. It's not just financial. It's the symposiums that we provide, all the conferences that people can go to, the critical illness pools out there trying to make it easy for every department.
As far as the mental health benefits that we provide, they are so important for individuals who need that higher level of treatment. So there are opportunities for individuals to apply for an inpatient treatment grant through the critical illness pool, and we will offset the cost of their treatment up to $10,000. So we have arrangements with a lot of facilities nationally as well as in Missouri, so that cost is never a barrier to treatment.
My mission and vision is for every firefighter, EMS, and dispatch personnel in the state to know about mental health struggles and to know to get help and be proactive. And when we're seeing some yellow flags, we're getting help. And so we're not reacting in the crisis mode. They are ordinary people doing an extraordinary job, and taking care of them has been the highlight of my professional career.
Don't look at the money value of it, look at the health and safety of your members that are out there doing the work. It's a small, minute cost to protect on the cancer side, to help financially offset anything they're going through, and then on the behavioral health side, it's there to save lives.
And it's a reflection of investing in the people that are working for you.
You know, a lot of these things that come out to help people in our services are lost on bureaucracy, and this is not one of them. This has been made, designed, and run by first responders, clinicians, and people who have been around the service for a long time.
I've seen the toll that it takes on first responders, both physically and mentally. So I think it's so important, you know, that the critical illness pool and organizations like us provide that support so that they realize that somebody has their back. There's an organization that cares about them as a person. We want everyone to have long and happy careers, but we want everybody to have long and happy retirements too. They're giving so much of themselves day in and day out for us, for their communities, and the least we can do is be there for them.
You want to be part of the critical illness pool because it's protecting our firefighters, paramedics, EMTs, and telecommunicators, and taking things into the future, because if we take care of our people better, we're taking care of the citizens of the state of Missouri better. And that's our job. It's public service. To do that, we've got to take care of ourselves.